What's up, guys? It's Dr. Tim Jackson with another episode of the Boss Body Podcast. Today, I have a very special guest, Dr. Beth McDougall. She's a medical doctor, integrative and functional medicine expert, and also into bioenergetics and resonance therapy.
While I make every effort to broadcast correct information, I'm also still learning. I will double check all my facts, but realize that healthcare is a constantly changing science and art. One doctor or healthcare provider may have a different way of doing things from another. I welcome any comments, suggestions, or correction of errors. I take no money from supplement or device companies. By listening to this podcast or reading this blog, you agree not to use this podcast or blog as medical advice or to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. Consult your healthcare provider for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast or the website. Under no circumstances shall any guests or contributors to the podcast or blog or any employees, associates, or affiliates of the Boss Body podcast be responsible for damages arising from use of the podcast or the blog. This blog or podcast should not be used in any legal capacity whatsoever, including but not limited to establishing the standard of care in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or the blog.
Welcome to the show, Dr. Beth.
Thank you so much, Tim.
Absolutely. So tell us a little bit about your background and what got you into integrative and functional medicine.
Well, I was interested in kind of holistic thinking very early in life and kind of mind-body connection and psychoneuroimmunology and all of that. And then early on, when I was at way before medical school, I got introduced to the work of Jeffrey Bland, Dr. Jeffrey Bland, and his kind of nutritional biochemistry and his understanding about how you can affect changes in biochemical pathways with nutrients. And so I started following him around in, let's say, the late 1980s, kind of ages me. So I was oriented like that before I went to medical school. And so when I went to medical school, I kept following Jeffrey Bland and got really into creating symposia at my medical school where I would invite people that I felt were experts in the field of what was then called complementary alternative medicine. So I invited like Andrew Weil and Jonathan Wright and Candace Pert and even people that studied Qigong and things like that. And we started a seminar series and a kind of a conference series back in medical school. So I really got to immerse myself in both worlds as I was going through school. And then I lucked out early on where the provost that came to power when I was kind of finishing up medical school came out of the closet, so to speak, about his interest in complementary alternative medicine. And then he mandated that a task force be formed to determine how to integrate it into the health science curricula and how to develop clinical electives. And I got to be on that task force as a medical student. And
So you weren't ostracized for doing this.
no, I was able to just kind of, keep a foot in both worlds. And, because I'd been kind of knew people around the country in this field that, as part of that task force, and we actually started a department at the University of Minnesota and and created didactic and clinical electives and just integrated it into the health science curricula. And I was able to stretch my medical school out into 5 years, and I studied in China and did electives around the country and things like that. So then I ended up sticking around there for residency so that I could kind of still be involved in those projects. And then I came out of residency into one of the oldest integrative medical clinics in the country. So it was the San Francisco Preventive Medical Group, and I was in a milieu of three other doctors that were bioidentical hormone specialists, and I also was the first crop of doctors that got trained in functional medicine. So in 1999, I did that applying functional medicine in clinical practice, the first education around that. So I've just kind of been in this for a long time and had a great run of a really successful practice in this area. And then a couple of years ago, I moved my clinic of 20 plus years into a much larger center because I was outgrowing the one I was in. And I co-founded this center, Jizen, with a couple other co-founders. And it's got integrative medicine, we've been told the largest suite of biooptimization technologies in the world under one roof. We have a full neuroscience department, full integrative bodywork department, and large IV space and laboratory and apothecary. And it's just a really cool collaboration with multiple experts and doctors.
So the neuroscience space, do you guys do like a baseline QEEG?
Mm-hmm. We do. And it's so helpful, because I specialize in unwinding complex illness. And it's so vital to be able to look at the brain, to see if the limbic system is stuck in a coherent, hypercoherent state, because that's going to throw the autonomic nervous system into fight or flight. Uh, it's important to see if there's been head trauma and there's areas of the brain with low voltage. And also find it incredibly important to just kind of take a look. Is the brain inflamed, or is it kind of globally suppressed, like global low voltage? Because there's different underpinnings in each case. Sometimes people have an immune reaction to mold, let's say, and that activates the immune system in the brain. And so you get this kind of like red inflamed brain.
I mean, mostly the microglial cells, or
Yeah, it activates basically the immune cells that surround the neurons. And you treat that and handle that very differently than someone who's been exposed to mold, and they don't have that immune response to it as much, as their mitochondria are suppressed by the mycotoxins that the mold produces. Then you get kind of like a global kind of low voltage situation. And it's just so important to kind of see that so you know what direction to head with people.
what are some ways that can you give us an example of how you handle the microglial activation versus the mitochondrial inhibition?
Mm-hmm. Yeah. So you would want to first like get someone out of moldy environment. I'm going to keep on the mold. There's other things that can cause microglial activation, but let's say it's mold. You want to, of course, get them out of the moldy environment, um, calm their immune system down. Like if oftentimes there's a deficiency of adrenal hormones, and so they've lost their checks and balances that the immune system normally needs to kind of dampen the inflammatory response and the kind of Th2 kind of allergic type response. So you would focus on adrenal support, kind of immune modulating hormones and nutrients, and get someone out of the mold. And then when they're ready, you can start treating the mold that they may have colonized in their body, whether it's their sinus tract, in cavity, lungs, or intestines. Um, and then you can keep looking at the brain and be like, okay, now the inflammation is kind of calming down. And then typically you have to kind of turn your attention to clearing mycotoxins and all of that. But yeah, there's just an order in which you're going to handle it.
Yeah,
If
so
it's
it's like the order of operations in that.
uh-huh. Yep. And if it's a blue brain, for example, which is low voltage, we're gonna start with mycotoxin detox right out of the gate. And also things to upregulate mitochondrial function like red light therapy and possibly methylene blue and you know um, other types of mitochondrial support.
Global hypoperfusion, would that result in a blue brain?
Yeah. Mm-hmm.
Okay.
Definitely.
And other things, so what are some other reasons someone might have low voltage, like globally in the central nervous system?
Well, neurotoxins that, you and I before the show, we're talking a little bit about like Cipro, for example, and fluoroquinolone toxicity can certainly lead to it. fluoroquinolone antibiotics like Cipro and Levaquin are direct mitochondrial toxins. And there are a lot of other toxicants that are as well. We find oftentimes that toxic exposure from industrial, toxins can suppress mitochondrial function. And so I do a lot of phospholipid IVs to try to flush those out of cell membranes and the intracellular organelle mitochondrial membranes, and then mop them up with like methylating agents and sulfating agents. That is a tried and true protocol that I've been able to use over the years and bring people from disability like back to work, and it changes lives. Pull those
Is it
toxins.
like the Patricia Kane protocol?
Yeah.
Yeah.
Hmm.
I love that. Several of the clinics I've worked in, we've used that. I've used it orally with kids. Have her book over on the bookshelf. I think it's great. I like to use a combination of binders and the
Yep.
lipid because I see some people they're like all binders, or other people are all lipid. I'm like, I think people benefit from both,
That's
in my
right. So
experience.
usually I have them on an oral protocol also that includes binders and some, some now I'm using the transdermal glutathione or sublingual liposomal glutathione, but like the transdermal has really good data on it for blood levels of glutathione. So that's a good thing to have on board as well.
Do you get it compounded?
No, there's a company now with, lots of research behind it called Gluteril.
Okay, I've heard of them.
It's a crazy good product.
I'll have to check that out. And so you have people apply to the forearms typically?
Yeah, you put about four little sprays on the forearm and you rub it. And first it feels like water and it
Yeah,
smells like rotten eggs, like the glutathione
right.
smell. And then you rub it a little longer and it turns a little like little viscous, and then it gets very sticky. And if you keep rubbing it, it totally disappears into the body and the smell goes away completely. You can't even smell it at all.
Yeah,
And then it's been shown to have like retain really high blood levels of glutathione for a long period of time.
right. And do you do any epigenetic testing to see where people might have biochemical glitches or hiccups?
Uh, yes, yes, a little bit. So we are sending blood to Europe to look at like toxin levels, heavy metal levels, and then they also look at the toxins that are found in the cell membranes, and then the mitochondrial membranes, and then they look at DNA adducts.
Okay,
Mm-hmm.
awesome.
Mm-hmm.
And in terms of, so going back to your training, when you left residency, was it hard to do your residency and, prescribe statins and all these other medications? And you were like, oh, I really want to do this and that.
Yeah. Yeah. It was a tough moment because, I would but whenever I would learn about a pharmaceutical, I'd always ask myself, okay, how can we produce the same effect using something that's native to the human body? Like, how can I adjust this biochemical pathway using a vitamin, a mineral, a amino acid, a bioidentical hormone, an essential fatty acid, or something that's native to the body. So, I was just having to kind of dual path it. And of course, even in this day, today, I still use pharmaceuticals when they're warranted. You're still going to need an antibiotic. There's still some people who you can't get their blood pressure down without an antihypertensive agent. And some people, it's not very common for me, but some people need a statin, occasionally.
Yeah,
Yeah.
yeah,
So,
absolutely.
yeah. So I'm glad I know all that. And, I'm glad I had that background.
Yeah. And then it sounds like as soon as you came out of residency, though, you went straight into what we now call functional integrative medicine.
Totally. Yep. I've
Yeah.
never worked in a regular setting.
Yeah. It seems so unhealthy, like, the mindset of, oh, we're going to make you stay up for 48 hours or,
Oh,
36 hours. Like, patients don't benefit, the doctors don't benefit, no one benefits.
yeah. It was kind of
So,
torturous. Yeah.
yeah. Uh, so how have you evolved since you first started practicing to now? Like obviously the technologies have gotten better biohacking gadgets, but what else has changed?
Gosh, well, I think that, I was able to help people, but to a point, in my early part of my career, I was definitely successful at helping people, but a lot of times I sensed there was a deeper layer that I wasn't getting to. I kind of saw that that had something to do with the traumas that they had experienced and kind of stored unmetabolized emotions in the energetic field that were eventually kind of translating into patterning the physiology. And so I, was aware of that, but I wasn't quite sure how to help people get to that level. And then I ended up getting Lyme disease myself in 2004. And it was a really interesting journey for me because you know, had been diagnosing a ton of Lyme disease in people by this point, but I typically would send people to my colleagues in the Bay Area that were like kind of Lyme literate, Lyme specialists, because I would co-manage them. And so all my colleagues that, knew me at that point were like, you need to get on IV antibiotics. You need to get on antibiotics for, at the minimum 12 weeks because I had a lot of neurological symptoms and I tried antibiotics and they just did not agree with me at all. Like no matter which one I tried, and actually ended up with some pretty serious side effects. And so I was just like, you know what? This chemical warfare approach does not quite sit well with me. Yes, I'm gonna try to treat the pathogens, but I'm gonna do it with um, homeopathy and IVC I even did some intravenous colloidal silver, and it was kind of before I had did much ozone, back in those days. Did some hydrogen peroxide IVs, things like that. And then I ended up doing a ton of energy work and changed a lot of meditation, kind of like tuned into the areas in my energetic field and body where I had emotional holding patterns and just it was like an intense period of personal growth for me where I was just kind of identifying, clearing, excavating, kind of all of this stored stuff from my history, my biography that was kind of encoded in my biology. And that was indispensable for getting me better. So it was kind of working on a physical level, yes, but then also doing all this deep work. And so then that shifted me a little bit. I ended up going after having that experience. I went to the Academy of Intuition Medicine, which exists in Sausalito, right next to where I practice here. And it had already been going since the late 80s. And it's run by a really scientifically oriented person who's a PhD, Dr. Francesca McCartney. And so I just spent 2.5 years studying there and looking at how we encode our biography and our biology really, and kind of looking at how to clear it in yourself and then how to help others. So I moved into that direction. And then I got more into biophysics and looking at kind of the energetic nature of our actual biology and even biochemistry. And so I started studying with Dr. Thomas Schultz, who is a contemporary of Dietrich Klinghardt. They both are well steeped in European biological medicine. And then Thomas Schultz was just super well versed in physics and biophysics. And that had always been an interest of mine, but I really dove into it. And from there, I learned some energetic testing methodology that kind of revolutionized my practice because I still did everything I used to do with a lot of testing that I'd send all over the world and, spending a lot of time with people in physical, history and physical. But then I would also do this energetic testing as well, just like another data stream. And it would kind of really, you could take a broad brushstroke, and ask a whole variety of questions of their innate intelligence to see, Do they have a dental cavitation? Like how much of a role are these kind of childhood traumas playing in their situation? Do they have electromagnetic stress playing a big role? What about geopathic stress, like where they live, where they sleep? Things that there aren't great tests for.
Right.
And not to say that, like there's not great tests for dental cavitary lesions, but you're not going to send everyone for a Panorex CT, right?
Right.
So it was a way for me to streamline like who I would send for that. Because like it used to be before this, I would do everything else and then I'd be like, God, they're not getting better. Okay, well, maybe it's a dental cavitary lesion. Now I'm going to send them to the biological dentist. I'm going to have that checked out. But in this case, it would be like, nope, this is priority one. Let's get them right over there. Let's get that tested. And sure enough, if I would find it energetically, I would find it once I sent them to get that x-ray. And then that started to kind of build confidence that like, yeah, oh yeah, the Bartonella signal is really strong for them. I'm going to keep testing until I find it. And sure enough, I would. So then I started to see this correlation over time and found that to be an incredibly beneficial adjunct. And then I learned from Dr. Schultz as well an energetic balancing treatment. So it was like different than the work I learned at the academy, where you're doing kind of energetic healing, remotely with people or whatever. This was more like kind of looking at the energetic signatures that are left in the system from infections or toxins or from a trauma or from, unmetabolized emotion or the energetic signature of stress from a relationship they may have or geopathic stress, like identifying that and then pulling it out of the system and unwinding the compensation that people have around that. And it was actually working miracles sometimes for people. And I could do that really deep work with people sometimes those that were committed and really interested to get to the root and fully unwind. Like, I had a patient that, for example, came in who came first visit with like noise canceling headphones, dark glasses, like a hood, like a blanket wrapped around, like all stimuli of any type was too much for her brain and her body. And she was so sick. And, we treated Lyme, we treated co-infections, we treated mold, we detoxed enormous quantities of petroleum derivatives and things like that. And she got a lot better, but then we started dealing with her early childhood trauma, doing this energetic balancing treatment, and that's when things really started moving for her.
And can you describe for people who may not be familiar with it, what an energetic balancing or the type of energetic balancing treatment that you do, what it looks like, for example?
Yeah. I mean, I don't do it as much anymore because it's like a 1 hour treatment, but it really helped formulate in my mind concepts that now I use a lot of technology to do. But this treatment that I still will do sometimes is
Mhm.
where it's called ACMOS. And I will use an instrument to measure someone's energetic field to see if it's balanced or imbalanced. And if it's imbalanced, then I go through an inquiry to ask like what is throwing their field off? Is it a pathogen? Is it a heavy metal? Is it a geopathic, whatever. I'm asking this kind of algorithm of questions, then I get the answer. And then I there's like a valaise of different essential oils, different homeopathics, minerals, etc. And so you're looking for something that's in resonance with that misinformation, the energetic signature that's throwing them off. You put this, let's say it's an essential oil. You put this into like a circuit, so to speak. You're putting it into this dish which resonates with what someone is holding in their hand. And then you it's in resonance with the misinformation. So then you do this procedure where you're drawing out the misinformation signature, almost like toward a magnet, this device, this oil. Then you're unwinding the compensation energetically that someone has around that misinformation. So, it's almost like some person's system is like wound up like an energetic pretzel. Like you pull that misinformation out, and then their whole polarity switches, and then you're kind of balancing them out, and you're basically pulling it out, then balancing, and then asking, okay, what next? Like, what else is throwing you off? What else is throwing you off? And sometimes it's it's more of an emotional, or sometimes it's a belief that you hold that that is no longer serving you, and you're conscious of it, but now you really are ready to let it go. So we're going to do a procedure here where we're going to facilitate like pulling that out, so that you may think those same thoughts in again, but it's not going to have the same impact on your physiology.
And how do you spell Acmos?
ACMOS, and it's an acronym. But yeah, not that many people do it. It's a really cool procedure, and I don't know exactly how many, but I would say under 10 people in the US do it.
And did you learn this at the institute that you were at for
I
two and a half
learned this
years?
with Dr. Thomas Schultz. Yeah.
To kind of circle, sorry, go ahead.
Yeah, at first when I saw him do that, I thought, there's no way. As an internist, I'm gonna sit and like wag a wand and like over a vial of oil with a patient. And then, I just heard the stories that, from him, of like people coming in wheelchairs and leaving, walking. I was like, okay, I got to just get over this. And who cares what people think? Like, people will come who are open to this, and I will do it with them. And that I started that probably in 2012, and saw such incredible things happen that I'm just like, okay, it looks funny, but who cares?
Right.
Yeah.
Wow.
Yeah.
And to circle back to the SOT therapy, so can you tell folks what it stands for and sort of how it works in the body?
Yeah. So, SOT is a therapy where we're making, kind of like single and oligonucleotide therapy for people. So this is where it's become like our go-to at Jizen for Lyme co-infections and chronic infections of other types, such as mycoplasma or chlamydia, pneumonia, where we will do broad infectious disease testing on people. And then if there's a positive finding, let's say Borrelia or Bartonella or Babesia, we will then draw blood again, send it to Greece, the RGCC lab in Greece, and we'll ask them to find that pathogen in the blood. And if they find the pathogen, which they usually will, they will make an SOT for that pathogen, which is usually an an mRNA, blocks the mRNA's translation into a protein of just that pathogen. So it's very specific to the RNA of that pathogen, and it prevents that pathogen from being able to replicate. So then they create that SOT, they send it back to us, and then it's administered to the patient intravenously.
It has to be
And
infused within 12 hours, right?
no, no.
No. Okay. I
Yeah,
thought
no.
it did.
Once it would be reconstituted, yeah. But like,
Okay.
yeah, it comes and you're almost like, well, what's in this vial? Nothing's in this vial. Like it looks like
Right.
nothing's in there. But then you reconstitute that and you give that to the person intravenously. And that's basically stops the replication of those pathogens. And why I love this for people is you're not killing the pathogens. But if you stop the ability of the pathogens to replicate, the pathogens have a lifespan and they die. So the the side effects of SOT therapy are so much lower than using an antibiotic or even an herb
Mhm.
or even an oxidative treatment to treat that pathogen. Because in those cases, you're going to have a die off. You're going to have some degree of a Herxheimer reaction. And sometimes that, people are between a rock and a hard place. Like they have these pathogens, but then you begin treating them before SOT, and the die off products would overwhelm the system. It would be more than the person could eliminate, and it would actually make them worse. And so many people, they are, you, they can't move forward. So this has just been the most graceful way of helping people get over these long-standing infections. And, as long as it's done properly, if it's in the right hands of the right practitioner and it's done properly and the pathogens are treated in the right order, because as we were saying, before the show, if someone has Bartonella and Lyme, you want to treat that Bartonella first, for example. And
Right.
so if you suspect Bartonella or it shows up on energetic testing and it doesn't show up on the lab testing, well, you better keep looking. You really
Right.
got to find that before you start this therapy. And,
Eh,
Dr. Maria Marion, who's handling the SOT program here at Gizen, she's just great with like priming the pump, like getting their pathways of elimination open, and just really has great strategies for minimizing, for improving the outcome. Let's put it that way.
You guys probably have like a flow presso for a lymph system or something similar.
No, and I would love to
No.
have that. That's a great suggestion. And we've looked at a couple therapies around lymphatic drainage, like, like well, we do the Hocket. Are you familiar with the
Okay.
Hocket?
Yeah. Hmm.
And you can set that, like, so Hocket is a infrared uh sauna capsule that also puts ozone into the chamber.
Hmm.
And when you're in there, there's a pulsed electromagnetic field therapy, which is really powerful and fantastic for charging your cell membranes. And then there's also frequency delivery while you're in the chamber, and you can set frequencies to open up pathways of elimination with the lymphatics or the kidneys or the liver, as well as
Okay.
any other supportive frequencies.
And for the SOT therapy, if someone, for example, has a cavitation and they have mycotoxins, do you need to address those first before beginning SOT?
Not necessarily first, but you definitely would address them to get them better. So a lot of times, the other thing that energetic testing comes in handy for is determining the sequence in which you should treat people for their various things that they have. Because it's like you have to kind of figure out, like, what's the priority for this person? Is their priority mold and mycotoxins, or is their priority, you know, Bartonella or Borrelia or Babesia, or is their priority their heavy metals or hormone balance or their reactivated viruses, or or their gut dysbiosis, or what?
Mhm.
Usually by this point, like, I kind of have a sense of, like, how to kind of prioritize certain things.
Right.
Like, you always want someone's hormones balanced first before you do anything, because it's such a low-hanging fruit and so easy to do, and then they feel so much better, and their immune system is more balanced, and they have more energy and kind of like a platform to work from. They can handle and tolerate stress better. And of course, if they have leaky gut from just eating the wrong foods, you want to address that immediately. Like, why not? Let's get that organized, and get the flora a little bit better balanced, and then kind of start looking at detox pathways and making sure that they're open and flowing. And then, you're deciding kind of which pathogens you're treating first, or, is it mold and mycotoxins?
And talk to us about brain retraining because we hear about DNRS, the Gupta training, the Primal Trust program, and how that can be the game changer for people.
Yes, it sure can. I mean, it can, for those who are committed to doing the work, because it's time consuming and hard. and it can make a big difference. I've had people that their immune systems were so sensitive and out of whack that they could only eat like 4 foods, and they reacted to every supplement, and they reacted to, multiple environmental, allergens and things like that. And then they go through the program, like the dynamic neural reprocessing type program, and they can broaden their diet out. They're even back on eating like gluten and things like that.
Mm.
It's, oh my God. But those individuals put a lot of work into it.
Yeah.
So I'm not dissing it, because like anyone who will do it, it's gonna help. It's gonna help. Uh and a lot of people just, they're busy, right? Like, and they're trying to work and have a family, and like they just don't do it.
Yeah.
And so the brain training that we do here, I really love, because it is a lot faster and it's different. But like when someone's limbic system is stuck in a hyper coherent state, we can usually unwind that in about 5 to 10 sessions of brain training. Like it's something that Cindy, our neuroscientist here, starts with. Like she has it like also like an order in which she approaches different things going on in the brain. And when that's first, when that's present, she goes there first and gets that organized. And then that makes my job so much easier, because like if she addresses that, then the autonomic nervous system is more balanced, and then the person detoxes better, their immune system works better, they sleep better, they like, their ability to handle stress is so much better. And so then it makes whatever I'm doing so much easier.
And in terms of, like you said, you find out the order of operations through energetic testing most of the time. Does it tell you sort of when to incorporate the neurofeedback training or the brain retraining?
That, so there's certain decisions I make without energetic testing. And if I'm speaking with someone and I, really sense that there's like a autonomic nervous system imbalance, or, they're something's up with their brain, or they have a history of head trauma, or maybe they have uh, ADHD, maybe they have brain fog, and we're just trying to get a window into that, like just to understand it better. I'm going to get a quantitative EEG right away.
Okay. And you said 10 sessions. Do you have people who come in who are just looking for, say, they're an athlete or a CEO? They
Mm.
want better reaction time. They may not have mycotoxins per se that they're complaining about. Do you have people who come in for that?
Oh yeah, lots. Cindy has a great saying. Um, she says, wait, what is it? Make a brain, make, what she does is she helps injured brains become better, and she makes good brains great. Like, she really can. She can just optimize reaction times, and optimize mental clarity, and optimize sleep quality, and optimize word retrieval, and all of that by kind of like addressing different things that need addressing in the brain.
Right. So I know like Dr. Dale Bredesen's work talks about, for example, you get hit, not just CTE, but tree falls on your head or a limb falls on your head. You get reactivated viruses, those microglia are activated. Do you use things like low-dose naltrexone to kind of dampen the inflammation?
Yeah, we do. Yep, we do. And uh then to activate low voltage neurons, which is often something that results after head trauma, we have really good protocols here. So Cindy will do via light in like targeted areas of low voltage, and then we do intravenous cerebral lysine here.
Mhm.
So it's got multiple peptides that stimulate neuroplasticity and kind of reduce inflammation in the brain. And then she will have someone do use the Vasper device, which
Mhm.
is a really cool like training device where you wear compression cuffs on your upper arms and upper thighs that has cold liquid going into them, and then you're doing like a hit workout on this device. while someone's breathing oxygen.
Wow,
And that really kindles the low voltage neurons as well.
that's super cool. And
Super
what's her background? She's a neuroscientist.
self-trained. Yeah. Yep.
Wow, that's awesome. Yeah, I'd love to connect with her at some point, maybe have her on. Just do a whole session on the brain. I
You would,
can't hear you.
you
There you
would
go.
love doing that. Yeah, she's incredible.
And yeah, I know you obviously can't use names, but I'm assuming you guys have pro athletes from all
Oh yeah,
sports.
we sure
Yeah.
do. Yep. And we have
And
MMA fighters, and we have NFL players and retired NFL players, and you know, people that have multiple head traumas. And
right,
this is so important, this type of work, because I believe we can spare them, like cognitive decline later in life.
absolutely. Yeah,
Hmm.
because you see guys, they're 30, 35, they don't know their daughter's name or their wife's name, and they made all this money, but what good did it do
What
them?
good is it? Yeah.
Yeah.
Yeah, no, it's
And,
incredible what we can
and
do.
now I know on your website, I think you're big into peptides, correct?
Very much.
Yeah. And so we talked about a little bit about cerebrolysine and then dihexa or cerebrolysine and dihexa, those are different. They're not the same, right?
They're different. Yeah.
Yeah.
And
And
then
then
for the brain, we
pep-
use a lot of CMAX and Selank. And then, just in our general practice, like when people have multi-infectious disease, we're using things to modulate the immune system, thymosin alpha, TB500. When people are really
LL37.
sick. I haven't used that.
You have it.
I would like to use that. MOTS-C for upregulating mitochondrial function. And we do so much work with the metabolism here. Like that's out of everything I see, that's the number one complaint. People
Yeah.
saying like, I'm cannot get the belly fat off nowadays. And they seem to be doing everything right. So we have really figured out how to crack the code with the metabolism. This is a big area that we handle here. And I can talk about how we do it, but yes, then for those individuals, we're using things to upregulate growth hormone production, CJC ipramorelin, for example, AOD, to try to burn fat, build muscle, and improve the metabolism.
And talk to us about head trauma and how that often results in low growth hormone, testosterone, sex hormones in
Yeah,
athletes.
definitely. So, um, interestingly, when you think about like the brain, the structures in the brain, the hypothalamus speaks with the pituitary, and the pituitary is in a very small bony cavity. It sits in it's basically
Celiturgica, right?
surrounded by bone. Yeah, the sella turcica is like a saddle, and then there's kind of bone all around it. And so if you've had head trauma, that that sensitive neuroendocrine tissue, can like bounce against the bone, and so I've had a lot of people like, one woman fell off an ATV, and like hurt her head, and uh and then she ended up with like full pituitary dysfunction after that, and organ hormone deficiency. So then we ended up having for her, to have to replace all of the pituitary and organ hormones. But for a lot of the fighters and things like that, yeah, it really throws the way the pituitary communicates with the testicles and the thyroid and the adrenals. So you have to be aware of that. Um, but for many individuals, you can repair, you can repair the brain. Like, for example, the protocol I just mentioned with the Vasper, has been shown to release brain-derived neurotropic growth factor, and that does lead to kind of restoration of nerve function, and it stimulates neuroplasticity and eventually can have beneficial effects on hormone balance. That protocol I mentioned also has been shown to trigger the release of anabolic, improve the release of anabolic steroids.
And do you guys use peptide bioregulators at all?
Uh, Not right now. we just talk about it as a group of like moving into that because it's a little bit easier, not as highly regulated at this moment. Do you use them?
A little bit. So Dr. Kent Holtorf, I don't know if you know him in Los
Yeah.
Angeles or Ellicott. Yeah. So
Totally.
he's a buddy of mine. I had him on the show, and
Mm-hmm.
um, I learned a lot from him about peptides and peptide bioregulation. Still got a lot to learn, but yeah, I like him.
They seem really straightforward, like easy to use. And so now it's just about finding the right source for bringing them into the practice.
Yeah,
Hmm.
absolutely. What's something, well, I know that you're going to have a lot of answers to this, but what's something you know today that you wish you would have known 8 to 10 years ago?
Well, SOT for one, I would say that like it just, you just see people that like maybe I treated long ago for Lyme and co-infections, and they they get a head trauma and boom, it comes back, or um, they have a stress and then it comes back, or maybe there's some people that I didn't fully successfully treat. And
Mhm.
now they have an autoimmune disorder, and it was their underlying infectious trigger for that. And so SOT to me just feels like this revolution in treatment for Lyme and co-infection. So that's one thing. And I think wow, NAD, I started using NAD really early on, but maybe not quite 12 years ago. And that's been a super game changer for a lot of people,
Yeah.
intravenous NAD.
I took a shot of it IM this morning, and man, it's like rocket fuel. I've done it
Yeah.
IV as well. I mean, of
Mm.
course, I take CoQ10 with it because obviously you need that in the electron transport chain, but I'm also doing from Dr. Holtorf some SS31. To use that.
Mm-mm.
Yeah, so SS31, the way Dr. Shazam Fareed told me to think about it is SS31 is more mitochondrial enhancement. No, I'm sorry. SS31 is more like chronic disease, I think, or people with health challenges, but that's what I got. Um, Not those health challenges, but I tried the SS31 and man, it's very synergistic with the NAD. I haven't tried the MOTS yet.
And SS31, is it a peptide?
Yeah, it's a peptide, and so I think it upregulates cardiolipin, just like
Oh,
MOTS. Yeah,
oh, wow. That's exciting.
yeah.
I
And so I
wonder.
just do it sub Q a couple times a week, and it's the first time I ever tried it, but I like it. And I know people don't think about thymosin alpha one as giving them energy, but it definitely gives me energy. Modulating cytokines, I think. I mean, I'm
Yeah.
kind of a cytokine nerd. Um, And so I think, brain fog, I mean, I don't really think I have brain fog, but my brain is even more clear when I do the thymosin alpha 1 or TB4.
That's good.
So, yeah.
Mm-hmm.
So I really like
Yeah.
those. Have you had any one where they did um the SOT therapy and it lasts for 6 months, correct?
Well, I think it can be indefinite.
Okay.
Yeah.
I didn't know if you had anyone who quote unquote relapsed.
Haven't seen it yet.
Okay.
Mm-hmm.
Awesome.
Mm-hmm.
That's great. So, wow. Yeah, I want to learn more about the SOT. Are you
Mm-hmm.
going to put together any training programs for healthcare providers in the future
Uh, it's on the docket. Yeah,
on the
because
to-do list?
yeah, I mean, what I've been really busy doing is putting together programs for Jizen because it's such a big center, and I so basically we've done a longevity program and a for local people, and then for remote individuals a metabolic health program for people that just are really stuck and trying to figure
Mhm.
out keys to their metabolism. And so we have one for local people and remote. And we have a cognitive decline, kind of program in the works right now because I get really good results kind of referring across the ecosystem here at Jizen for that. And it's doing all the things we just mentioned, diagnosing infections, cavitary lesions in the jaw, um, molder mycotoxins, industrial toxicants, etc., kind of whatever is causing inflammation in the brain, balancing the hormones, improving the metabolism, all of that, doing the brain training work, all really plays into helping people reverse cognitive decline. And then we have a program here for peak athletes. We have a program for young athletes, people that are really interested in just improving their athletic performance. And so that's what I spend most of my time doing right now.
Awesome. Do you still see patients?
I do. Yeah, I see patients now 3 days a week.
Okay. And where can people find you?
They can find me through the website Jyzen.com. So
Okay.
Jyzen. And they can also find me on social media, Beth McDougall, MD, on Instagram, Facebook, etc.
And is your practice, I'm guessing you're not accepting new patients?
Right. At this moment, I will occasionally, but most of the time, I refer my referrals to the other doctors, and then I'm always here, to
Right.
co-manage and supervise.
Awesome. Well, you're a wealth of knowledge. I really enjoyed the interview. Thank you so much for the work that you're doing. And hopefully we can have you back on in the future
Yeah,
for an update.
I would love that. Well, thank you so much, Tim.
All right. Thank you so much. Have a great day, Beth.
Okay.